Hi, everyone. I'm Dr. Jennifer Miller with Pediatric Associates in Lancaster, and I'm joined today with Dr. Narissa Bauer, my friend, who's here to help talk to us about ADHD. Dr. Bauer is a behavioral pediatrician in Carmel, Indiana, who has some great expertise helping kids with ADHD and helping families learn how to help their kids with ADHD. So she's going to help us out and answer a few of the most common questions that we get in our practice today. So thanks for joining us, Narissa.
Yes, you're welcome. I'm really excited to be here.
Thanks. All right. So one of our biggest challenges and most common concerns that comes up in a pediatric practice is, does my child have ADHD? Or do they have a learning disability when they're struggling in the classroom, they're not performing on grade level and, following all the tasks and things going on in the rest of the classroom. So when we're working on a formal ADHD evaluation, we book an hour-long appointment. We go through a lot of things all the way back to when the kid first learned to walk and talk. Was that on time? Do they have normal vision, normal hearing? And look at forms that parents and teachers fill out, called Vanderbilt forms, that ask a lot of questions about a kid's behavior and performance in the classroom and behavior and performance at home. And we kind of take all of that into consideration when we're making those determinations on what the kid is struggling with and how we can best help them. So I wanted to ask you, from your experience, what are some of the things parents can look out for and take note of to bring their concerns to us to help kind of determine if it truly is ADHD or a learning disability, and at what ages each of those things typically become more diagnosable?
Yeah, that's a great question. And as you can imagine, we've been hearing it a lot this past
Yes.
year, especially
Yeah.
given remote learning and how challenging it's been. The one great thing that came out of COVID, if you can say that there's been one great thing, is that, when kids are doing remote learning, parents actually have the opportunity for the first time to see how they attend and how they pay attention, what they're learning,
Yeah.
and what that looks like, right?
Mhm.
So I've had, as well as I know you have had, a lot of parents come back concerned and like, oh my gosh, they're not learning. They're tired of Zoom. They don't want to pay attention. How do I
Mhm.
get them motivated? And, I think the tricky thing with any behavioral or mental health issue is that there's not a imaging study. There's not
Right.
a brain scan or a swab test that, they can go see
Yeah.
you, Dr. Miller, and, get that done and say, oh, it's this, right?
Yeah.
The issue is that what parents and teachers and even the child can do is self-report these behaviors or symptoms. And sometimes, parents aren't quite sure, is this something that, we need to be concerned about? So what I often tell parents, first of all, is to take stock in what you're seeing. And there's a great handout that was developed by understood.org and the American Academy of Pediatrics that actually I was the
Yeah.
spokesperson for. It's called Take
Yeah.
Note. And N
Great.
stands for notice, O for observe, T for talk, and E for engage. And it helps parents just organize, like, what are the behaviors of concern? What are you seeing? How frequently are they happening? And, is it just in certain hours of the day, or how frequent is it? How severe? And how does it impact the family? And so I think this is
Yeah.
key to helping parents first say, what I have to say is important because I'm seeing my child, and how they learn in this
Right.
weird and different time. But
Yeah.
your opinion matters. And so taking those notes to either myself, someone like me, or to the primary care pediatrician and being able to say, these are some of my concerns. I don't even know if this is something, but I just have
Yeah.
been seeing this has really been challenging for us. And, obviously there are those red flags, the traditional ones for ADHD, which
Yeah.
stands for attention deficit hyperactivity disorder. So making careless mistakes, rushing through things,
Mhm.
not being able to sit still, needing to constantly get up, blurting
Yep.
out answers, like pushing on all the buttons during Zoom or chatting in them,
Yes.
when they're not supposed to be, right?
Yes.
So those are like, you can absolutely see those. And but then there are other things too that are more subtle, right? Because with ADHD, oftentimes when it presents even younger in younger kids, and yes, we can make diagnoses in kids as young as preschool age. However, what we know is that when kids are first learning to read, they're learning to read, right? And then at around grade 3 or 4, they have to read to learn. And that is such a
Yeah.
different skill, right? You have to
Yes.
retain what you're reading. You have to be able to apply and recall that information. And that's where we see another sort of spike, so to speak, in
Yeah.
ADHD being diagnosed, because that is just what we call problems with executive functioning. And that we know is very characteristic of a child who has attention deficit hyperactivity disorder. But we oftentimes don't make the diagnosis of a learning disability right away. It sort of is, again, knowing where the child is struggling, what is it consistently in a certain subject area or related areas, and how is it impacting the child?
Yeah. Yes, that is so helpful. And that's one of the things that, as we're trying to, tease that out during those big evaluations, when we do determine that it is, classic, straightforward, attention deficit disorder or ADHD with a hyperactivity component, a lot of times we're talking to the parents about, what the teachers are already doing in the classroom that is helping that child, whether that's a wiggle seat or extra time to correct mistakes on an assignment, or different teachers have different things, seating arrangements, whatever. And we talk to the parent too about, maybe you should talk to the school, let them know, your kid now has this diagnosis, and does that qualify them for an IEP, which is individualized education plan, or a 504 plan, which is
Mhm.
similar. Can you talk a little bit about the differences between those two things, which child might qualify and how that can benefit them when they have this diagnosis?
Sure, I'm happy to do that. I mean, this is a really important discussion. I'm glad you're having that in primary care,
Yes.
because what I often will tell parents is that these two things, IEPs, or what we call individual education plan, or 504s, they are both under the umbrella of the Individual with Disabilities Education Act. And
Yes.
um, it is a special education law that protects and provides for the rights and provides rights for children to learn in the least restrictive environment, right?
Right.
They differ a little bit in some distinct ways. So I like that you are bringing it up at the time when you ascertain, like you come up with that diagnosis of ADHD, because one
Right.
of the categories that kids need to have is 13 of these different sort of diagnoses to qualify for an IEP. And some of them are like autism, intellectual
Yes.
disability, traumatic brain injury, visual and hearing impairments, but the ADHD, anxiety, those types of diagnoses, they often will fall under something called OHI, or other health impaired. The
Gotcha.
biggest thing, though, is that the child has to be having challenges in that normal classroom environment, right? Um,
Right.
whereas whereas a 504, not all kids, just because you have ADHD, means that you will qualify for an IEP. So the school will take a look at a lot of different things, including how well that child is learning in the main classroom. But if they are doing fine, and let's say I've had this happen too, if you put a child on medication and they're actually
Yeah.
doing great, then
Right.
sometimes they don't qualify for these things anymore,
Right.
right?
Exactly.
Because they're able to function and do well. But I always
Yeah.
tell parents that, in that case, then try to go for a 504. And a
Yeah.
504 is a list of accommodations that happen in the classroom that can be, extended time for tests, preferential seating closer to the teacher,
Yes.
away from windows, right? An extra set of
Mm-hmm.
books at home, more test time, or reduced, time, or I'm sorry, reduced number of problems to
Right.
complete. And those can benefit kids, especially if they have the attention or learning differences too. Um,
Right.
but the biggest difference, though, with an IEP is that children are oftentimes pulled out of the main classroom to get one-on-one or
Yeah.
small group support.
Gotcha.
Whereas with a 504, these are just accommodations that are made, but they stay in that main classroom setting.
That's super helpful.
But the biggest thing is that please do not wait to at least start communicating with the school, because like when you first start the process, I often tell parents, write a letter, date it, and submit it to the school. And then it gives the school 10 business working days to decide, are they going to move forward or not, to see if the child is eligible. And if they decide that they're going to go ahead and evaluate, that gives them another 50 business working days to do testing, to get more information, to do observations in the classroom, to get information from parents. So it's not a fast process at all.
Right.
So you do not want to be trying to do this in a crisis moment.
Yes.
Right. But the good
Yes.
thing is once you have one of these, it gets you a seat at the table to reevaluate with the school every year. How is your child doing? Are they meeting their goals? Are they learning? Are they thriving?
Right.
And then you
Mhm.
can reevaluate every year moving forward.
Yeah, those are some great tips and some things that I didn't even realize were some of the little nuances and differences between the two. So
Yeah.
that's super helpful.
Yeah, and I often will tell parents, if you need any more information about it, I would highly recommend going to understood.org. It's a
Yes.
wonderful website, and they have oftentimes free webinars with experts, and you can look up very practical strategies there.
Right. Yeah. Great tips. Yeah. Some of the things that we see, obviously here in Ohio, it's, similar 504 plan IEP kind of rules is, like you said, those kids that are really doing really well in the classroom. Sometimes we hear from a parent that says, yeah, they're really doing well this year, but the teacher has a kid who has ADHD and she really understands my kid and allows these different accommodations because of that. And then we kind of go back and tell them, get it in writing, ask the
Yes.
school to put it in writing for a 504 plan or IEP so that they know what works for your child, and that can carry through to next year's teacher who may or may not have the same skill set that this year's teacher has. So
Yes.
that's where we often recommend them too. But I wanted to ask you another question along those same lines with the pandemic this year and so many people doing online learning through Zoom and Google Classroom, or even people trying to homeschool. Obviously, if their kid has ADHD or ADD and they, in the school setting, in-person classroom has some of those accommodations written into an IEP or 504 plan, those are a little harder to work into your homeschooling process when you're in a different setting. You don't have all the extra resources and things that the school has. So tell us what kind of tips you have for that situation and what parents can best do to help their child learn when they're learning from a home-based setting.
Yeah, I mean, first of all, I think we hats off to teachers, hats off to parents
Yes.
who've had to deal with this pandemic. It's not been easy for anybody. So one of the biggest things that I would say, and I guess a couple quick tips, is just recognize the fact that home and school, those two environments, are never going to be the same.
Right.
Right.
Yes.
So as much as possible, trying to set up some sort of structure. I often recommend that parents, again, we're a year into this, so you probably already have like a dedicated workstation. If your child has ADHD, do not put it like right next to heavy traffic areas or like by a window where they're easily distracted. Sometimes buying those things that you use for science fair to block out kind of extra.
The trifold.
The trifold, right? That can be really helpful. They can decorate it however they want, but again, keeping that up to block out just extra stimuli there is really helpful. But then also sort of having like what I call a morning huddle with your child, like quickly check their school website, see, okay, what are we going to be doing? Do we have a Zoom here or here? If you have a Zoom that you need to remember to log on, like set a timer so that way you can log on 5 minutes before just to double check your technology, make sure it's working, right?
Right.
And then color coding or whatever that you have to do for notes. One of the things though, when you have a child who has like a 504, and a lot of times parents are like, well, how am I supposed to get the supports when we're virtual learning, right? That's really difficult.
Right.
I've seen it kind of be a little bit different depending on the school system and what resources they have available. But I know that oftentimes the special education teachers and the teacher themselves will reach out to the parents, sort of review what they had in writing and try to accommodate for those. So what does that mean? Like more frequent check-ins with the child, making sure if you can ask for any notes ahead of time or rubrics that then parents can follow to make sure that their child is completing the assignment as needed. Because oftentimes parents are really busy and they don't know where to look on the website, right? And then another quick tip, is if you find that your child is just burning out after being on Zoom for a long time, is I like these visual timers. And so oftentimes if kids are having just a hard time getting even started, I will have this discussion with kids is, you can set a timer for 15 minutes and anybody can do something for 15 minutes, just knowing that there's an endpoint, right? But then, sort of just, okay, we're going to do it. And then afterwards, we're going to go have a snack. We're going to go outside. We're going to walk the dog. We're going to do this. We're going to do that. But, and then steadily increasing. So if you have a middle schooler, setting it for, 25, 30 minutes. But again, you can use these strategies to help build that stamina to be able to continue to do the work at home. It's hard though. It's hard.
It is. And the brain's just like any muscle. You got to train it and keep it the right way to do things and kind of build that up. I like that analogy.
Yep.
Well, thank you so much, Dr. Bauer, for sharing some of those great insights with us. We know you have a great website called Let's Talk Kids Health that has a lot of great parenting tips and things on there, as well as a Facebook page, and a course called Teach Me ADHD. So tell us a little bit more about those things and where people can reach out to find out more.
Yeah, thanks. Thanks for asking. So one of the labors of love that I did last year, and what was great for me, was that I finally just got this chance to think about, well, how can I go ahead and begin to provide that support that families need, right? Especially after that diagnosis of ADHD, what happens, they oftentimes will have to go and get, behavioral therapy or parenting support at different places. And with COVID, we want to make sure that we minimize exposure and all of that, plus schedules, right?
Right.
So I actually created this online class, and it's on Zoom. And yes, we were just talking about how kids are burnt out on Zoom, but it's an 8-week class that kids newly diagnosed with ADHD, 8 to 12, take with their parents so that they can learn together all about ADHD and what they can do to help themselves so that they can keep their brain healthy, they understand more about what's going on, because oftentimes I find that kids are a little bit more resistant to doing things if they don't understand, right, what's going on. And so I've in this course, kids and families learn everything they need to know about ADHD, including, like I said, healthy sleep, healthy eating, negative thoughts, organization, how to plan, communication, all of those things. And at the end of it, they are ready to co-create an ADHD care plan and then bring it back to you, Dr. Miller, right? And then they get to show off.
Great.
They get to show off all their knowledge and then, kids learn to advocate for themselves. They're like, I don't really like this medicine, how it makes me feel, or I'm having a hard time, paying attention in this class. I mean, they're better able to recognize their own needs. So that's called Teach Me ADHD. There's a detective team. Yeah, and there's family missions, and it's a lot of fun. And then parents and families get 6 months of support beyond that. So if you're interested, you can always go to the website there, check out my course page, and then I have a blog too.
Perfect. That's a great age to teach that responsibility to kids and, being a part of their own care coordination or their own health. And, parents are active participants in that as well, which is great. And that's the most successful outcomes we have is when the parents are actively involved and engaged in the success of their kids too. So I love that. Thank you so much.
Of course.
It's been great talking to you today. Thank you. So hopefully we'll have some more guests soon for Pediatric Associates. We'll keep bringing you great content.